The Georgetown Municipality's Public Health Department is working closely with food establishments to ensure they embrace proper food safety practices. More than 50 restaurants around the city were surveyed recently to determine their level of compliance with requisite standards.
Recommendations include an increased number of inspections to food service establishments while enforcing stricter adherence to food safety practices in non-compliant restaurants. This is where there will be an expanded scope of food handlers training and having persons evaluated based on competence.
What we can work on, which is the first easier part, is make the educative talks or the lectures or the seminars, as we call it, different. Make practical sessions in it. Because we have ongoing lectures every day at the end of every food handler session, Tuesdays through Fridays. So we could start by working in that arena, which we're able to. It's not costly, it just needs a little more thought into what we deliver and how we deliver it.
The survey on food service establishments in Georgetown was conducted during the period September 2018 to March 2019 by the city's Public Health Department with support from the government's Analyst Food and Drug Department. A summary of data showed that there was need to place more emphasis on the way food is handled before it reaches the consumer. Tests were done on food samples, hand hygiene, sanitation of utensils, among others.
Of the samples taken from the 51 restaurants, only 15% of those restaurants instituted adequate means of protecting ready-to-eat foods from cross-contamination. The use of gloves when handling food was also found to be inadequate in 12% of the 20% of restaurants that employ the use of gloves. Laboratory hand hygiene results supported the observation of improper and inadequate hand washing practices, with 49% of them coming out unsatisfactory.
The survey aimed to determine the effectiveness of hand washing, quality of air in food processing and serving areas, microbiological safety for food, and whether food serving containers are safe for use. For InfoHub, DELICIA HAYNES.